So we're going to start with the medial and lateral malleoli. So we come on to our medial first of all. So we're going to follow the tibia. So the medial malleolus is at the distal end of the tibia. The tibia we know is at the front and slightly medial part, which essentially is in the shin here. So if we come from here and palpate our way down, on this front part we will then come to what is essentially like a ball at the end of this stick. So as we come down there, we'll then find that medial malleolus which sticks out just in there. All of that, when you're identifying, is the medial malleolus. Okay. For the lateral, same thing, but this now is at the distal end of the fibula. So we've got the fibula and the line there of the perineals that we can trace down and feel we should be in soft tissue, and then the fibula starts to feel like it comes to the surface. There it is, nice and clear. We come down, and then again we come to this slightly smaller ball at the end, distal end of the bone. Okay, so all of that is the lateral malleolus. Okay, next up is the anterior border of the tibia to the tibial tuberosity. So we know that that comes from the medial malleolus. We know how to find that. So then from there we can now palpate right the way up the front of the shin. And you need to feel as much as you can of this shin. Don't rush your way through. And you should also be feeling for, sort of, especially in things like football where they might have some ridges on the front, it might almost feel like a serrated knife where it sort of goes bumps up and down where they've had some trauma to the front of the shin. Okay, so we can come all the way up here till we get to the very top where again it just sticks out slightly, and that point there is the tibial tuberosity, which is just underneath the patella and the patella tendon. Okay, so just here is our tibial tuberosity. Okay, talocrural joint line. We're going to feel for the lateral malleolus, the medial malleolus. We know that they stick down a different amount on each side. So the lateral malleolus comes down further than the medial. So on the lateral side we can't feel talus, whereas on the medial side we can. So on the lateral side we're going to come up around about 2 centimetres from the distal tip, remember, don't feel the outside and come up because you'll miss it. From the distal tip you come up about 2 centimetres, medial distal tip you come up about 1 centimetre, and then come across. And it's very generic, that, so you need to then feel where that comes together. Feel inside there. You should feel you're at the end of the tibia, okay? And then bring the ankle up into dorsiflexion and plantar flexion to feel if you are kind of at the fulcrum of movement where that joint is, okay? If you think you're not, well, just move slightly distally and try again. Okay, and if you start moving with it, which I'm starting to now, then I know that I've gone too far. Yeah, so I come back up to where I was, right at the point where the joint line is. Okay, so that then is the joint point there, and the joint line is effectively from those two. Okay. Okay, next up is the medial tubercle of the calcaneus. So the calcaneus is our heel bone in essence, okay, it sits underneath the talus. For the medial tubercle, which essentially is the sticking out part of this medial portion, we're going to come from this soft tissue area here on the medial border of the foot. Okay, so coming all the way down here, should be nice and soft, and then we get to a harder bone landmark there, and that then is our medial tubercle of the calcaneus. Okay, you can then also feel right the way around all of this calcaneum here, right the way around to the lateral side, feeling all the way from medial to lateral. Okay, because this is all calcaneum here. Next up is the Sustentaculum Tali. So that's essentially a shelf that the talus then sits on top of. We know we can feel the talus on this medial side, so that's how you can remember then Sustentaculum Tali is on that side. So we come from the medial malleolus, distal tip, And then just underneath there, that is the talus. Come down a little bit further and have a feel, and you'll feel there's just like a little ridge that sticks out just in here. There's a ridge sticking out, and that is the Sustentaculum Tali, where the talus is then sitting on top of it. Okay. Next up is the tuberosity of the navicular. From the Sustentaculum Tali, if we come forwards relative to the sole of the foot, so you can see that we do that way, we just follow that forwards until we come again to another landmark where the bone is sticking out. That there is the medial tuberosity of navicular. Navicular being here. So it's the medial edge. Okay. Cuboid is on the lateral side. So for cuboid, we also need to go along with one of the next portions that you're going to need to find, which is the base of the fifth metatarsal. So base of the fifth metatarsal, we just run along this lateral edge. Okay, so we have sort of a slightly softer part, and then what happens is it dips outwards, out to the side. That is the base of the fifth metatarsal, so we've got a bony landmark sticking out. From there, if you just drop off it and then come up the side of the foot, that there, flattened surface, is the cuboid. Okay, so this is the cuboid on the lateral side, just here. Okay, it's essentially behind those bones. We've already found the base of the fifth metatarsal, as we've just said. Next up is the shafts of the metatarsals and then the heads. So we've got the base this end, the head this end, and the shaft is in between the two. So from there, from the base of the fifth, we can run along the shaft, and then we're going to find the head. Now it's quite important you're also feeling from underneath as well as on top, but you will get the most out of this feeling of the bone on the top, because this is essentially just skin and a few tendons, whereas underneath it's much thicker tissue. So therefore, if we go from here, we can feel all the way along, feeling the shaft right the way through to the head of the fifth. Then we can move along to the fourth, and again you can reverse it, so it's probably slightly easier for you to palpate from the head, shaft, and then bases of 4, 3, 2 and 1. So there's the head, and I palpate along until you get to just at the very end there, where we then drop into the joint, and that's then back onto the base. Then come onto the head again, work your way along, etc., all the way along down to the first. Okay, next up is the deltoid ligament. So we have the medial side for the deltoid ligament. Quite a thick ligament here. It's a very, very strong member on this medial side. It's the lateral side that tends to be more of our injured area. And it's deltoid because it's deltoidus in shape, which is this triangular type shape here. So we have an anterior portion running anteriorly and inferiorly. Then we have a transverse that comes across here. And then posteriorly we have another, essentially the posterior edge of this triangle. So it's from this posterior medial malleolus down and posteriorly, the transverse band across there, and then the anterior band at the front. Okay, coming anterior and inferiorly. For the lateral side, we then have at the very at the distal end again, lateral malleolus at the front, the ATFL, the anterior talofibular ligament. So from the very, very front, so this is the malleolus here. We are right at the very front edge, and it's quite short, and it's just in there. Most people think it comes down here, it doesn't. It's right at the very front. That is our ATFL, onto the talus, the talus being just in there. Next up is the CFL. And again, also, when we're trying to feel for that, if you want to, you can put it on a stress to take it into plantar flexion and inversion. It can just make it slightly more exposed, and also because the ligament is then on a stress, slightly easier to find pain and problems with it. For CFL, so this is just now straight down from the lateral malleolus down onto the calcaneum. So again, we're just going to feel down that line at the distal tip. That's where the CFL is. because if we go front to back, sometimes you can feel almost like it feels like a little rubber band underneath. And again, we can put it on a stress, just taking it into inversion. Pure inversion, then we can feel a little bit of CFL. And then last of all, PTFL, so again running posteriorly, very much like ATFL, it's almost completely anterior. This one is almost completely posterior in its orientation. So right in the very, very back, and that one we bring it up into dorsiflexion and inversion, and then feel for the PTFL in the back. Okay, next up is for the syndesmosis joints, the AITFL, anterior inferior Tibiofibular Ligament. So where we're essentially joining the tibia and the fibula, because they are two separate bones that need to be joined together. And it's inferior because it's at this end. So what we have there is just superior, therefore, to the talocrural joint, just in there. And you want to come at it from the lateral side is the AITFL. You just see Neil there twitching because this is one of his key areas of pain sometimes. Okay, so right in the very front, just there. The posterior version, so same thing but posteriorly, so therefore back in around the back, again just up that little bit higher. Okay, so PTFL was here, we're higher up into the ligament, and that's just in there. Last of all, the syndesmosis. So now from that point you're then going to feel along the joint between the talus and the fibula in the very anterior surface. You're going to come up about quarter or a third of the shin, and you're just going to palpate in that joint line, feeling for any pain or discomfort right in there. Okay.